This conference was a joint effort with lots of people, including Mary Bernstein, Blair Johnson, myself, and we received generous funding from Alan Bennett and his fund at CLES. This conference is an important conversation to have because there is no space for gun policy researchers to come together and share their ideas, share their research methods, share their challenges, and share ways to overcome those challenges. Also, there's not a place for them to hear from policymakers, from researchers, from those whose lives are impacted by gun violence. And so we wanted to provide a space away from the distraction of our lives, of our other responsibilities, and come together and focus on this important problem.
58% of Americans believe that guns make us safer. And that's a 50% increase over the past 20 years or so. And so if people don't believe that guns are dangerous, they're not going to be supportive of making laws stronger. And so I think the research there really gets beyond just preventing gun violence. It's how do you change attitudes? And I mean, the facts are there, and they probably heard the facts, they just don't believe them. And so what's the process for dealing with that? So much research, and we heard about a lot of it yesterday, that shows that more guns are associated with more gun violence. The problem is people don't believe that. So safe storage is incredibly effective for other than the gun owner, and particularly among teens. It's something like 80% of teens who die by gun suicide get the guns from their parents or family member. So safe storage is hugely important. And Connecticut right now actually is working on tightening our safe storage laws, which right now only apply to loaded guns. So you have to safely store it if it's loaded, but if it's unloaded and the ammunition is sitting on the table, that's okay.
If you live in a district where you know that there's just a generalized, either there's a violent culture in the community nearby, or it's just a general worry that you have for sort of the well-being of students, the school budget is a statement of the values of that district, and our state budgets are a statement of the values that we have. And so as a citizen advocate, whenever I see that there's going to be a reduction on the support side, I'm always one to reach out to my local school board or our superintendent, and that's, I think, where the advocacy really begins. But then we have a responsibility as researchers to actually show the broader patterns. There's a lot of supports that already exist that involve some sort of screening process for families to help identify families that are in need of support. So when there's a home visiting intervention in early childhood days, there's actually a screener that helps identify whether there's a challenge in terms of interpersonal violence in the home, which we'll hear about in a moment, or if there's a challenge around actual sort of fear of violence in the home or in the community. I think that there's a lot of opportunities that already exist. It's just getting that information, like amplifying the power of it so that we can direct resources and make a case for investing.
We're working with a whole family support system in the Office of Early Childhood. So we're really concerned about children and families getting the supports that they need as early as in utero, so that they feel as though they're supported and safe and they are tapped into community resources so that they don't fall prey to different kinds of issues in their lives that could impact development over time.
What actually makes you safer versus what actually makes you feel safer. And so there is this dialogue, from a victim perspective. Okay, you're going to take away his firearms. If he really wants to do something, he's going to get it done. There's this pushback of, if you make it harder to get a firearm, then you're going to take away the potential for that victim to be able to protect themselves. So this whole concept of giving good guys the guns, which I don't agree with, and I think you can tell by my tone, but I think that that's like a piece of this conversation.
More guns just leads to more either homicides or suicides. I think very interesting, there's no substitution to non-gun homicide. So we don't stop killing people with guns and start killing people with knives, right? Because guns are just very good at killing people. It's hard to substitute them. One of the problems with the FBI data is that it's voluntary. States voluntarily give their data to the FBI, and so sometimes they don't. And if a state doesn't give a number, that doesn't mean that there were 0 homicides. That means we don't know how many homicides there were, right? And so there's categorization problems, there's just cataloging problems, etc.
So I introduced a policy this year to put a 50% tax on ammunition. And I did that because I think we need to be doing a number of things to prevent gun violence. And so gun violence has a cost.
Gun violence is actually it's a really important public health issue. Gun-related deaths are the second leading cause of death for adolescents in this country. We really want to emphasize that community violence happens in communities.
When I think about community violence, I think of myself as a child, walking through pissy hallways, in the corner, drug dealers, shootings happening all the time. I think about the visuals that are on a lot of corners in the city of Hartford, where a lot of these young people go to elementary school and have to see 100 candles and bottles of liquor, you know, and just the adding of all this violence and that just becomes a bomb for them, you know, when they become adults. There's a community out there trying to heal our community that needs healing also. And I believe that there needs to be some look into that and how these people are being affected and how can we better support the healers that are healing our community. I thought about an app that could be a national app that could reach the people that the mental health community is not reaching. Just a simple app that somebody that feels like they're going through something can maybe do like an assessment or evaluation or something. When you're a youth and you're growing up in a community that's infested with drugs and violence and poverty, you know, that in itself, you know, will add up to somebody either being a perpetrator of violence or becoming a victim of violence.
Yeah, one of the things that we talked about is this idea that people who are perpetrators are almost always also victims of gun violence, and we have to think about healing not just victims, but the entire community and people who perpetrate violence.
Yeah, the hurt people, you know, and lives save lives.
There's this huge link between witnessing in addition to being shot. So you would think that being shot would put you at kind of the highest risk for PTSD, but actually witnessing a homicide was in sort of the small study that was done at the hospital, 100% of the people who witnessed a homicide were showing symptoms of PTSD, or showing I think it's 3 of the symptoms of PTSD. So that actually is something I think that has just gone incredibly under researched, just sort of how prevalent these symptoms are and how much this is really creating just huge numbers of trauma in communities that experience a lot of community violence.
Research that's being done right now, kind of within the program that I worked in, by Carol Reese and Madison Hammett, showed that people who witnessed a homicide were basically 100% risk for PTSD, and some of that shows us again that this is just a huge issue. Anybody who, if we're looking at those kinds of numbers, that the issue is much larger than anybody really understood. And part of the problem too is that there's no diagnosis for what we would call complex trauma, where it's sort of ongoing. It's not a single incident trauma the way we define PTSD, and so that's made it really hard to do research around, because it's not diagnosed. Yeah, it's not a diagnosable thing, and so I think just looking at how this is different than the single incident PTSD is really important. And our sort of small level research at within the hospital is showing us that and kind of what the differences are, but that needs to be done on larger scales, and we need to do more of that.
Nationally, there are about 40,000 gun deaths in this country every year. About 2/3 of those gun deaths, people die by suicide. About 1/3 of those are gun homicide injury related. And so this is a huge problem, and it requires a response. And so we hope that this forum allowed an opportunity for people to come together, to talk, to share ideas, and leave motivated with new questions and perhaps new partnerships to engage with this work.